Health alert. Why do dogs stick out their tongues when they're sick? Dogs use their tongues for a variety of functions, such as regulating their body temperature, communicating, and exploring their surroundings. However, when a dog is sick, the habit of sticking out their tongues more frequently or in an unusual way can be a warning sign for their owners. Body temperature regulation. The main function of a dog's tongue is to help with thermoregulation. Unlike humans, dogs do not sweat all over their bodies, but they release heat through panting and their tongues. When a dog has a fever or is suffering from heat stroke, they may start sticking out their tongues more in an attempt to lower their temperature. In these cases, the dog may also show signs such as weakness, rapid breathing, and apathy. What to do? If your dog is panting excessively, try to cool him down by offering him fresh water and a ventilated place. If the signs persist, take him to the vet immediately. Nausea and vomiting. If your dog is feeling nauseous, he may start licking his lips and sticking out his tongue repeatedly. This happens because the animal is trying to relieve gastric discomfort or even induce vomiting. Gastrointestinal problems, such as food poisoning, gastritis, or ingestion of foreign objects, can cause this behavior. What to do? Watch for other symptoms in your dog, such as excessive salivation, vomiting, diarrhea, or lack of appetite. If you notice persistent symptoms, take him to the vet, as specific treatment may be necessary. Dehydration. Dehydration causes dogs to have a dry mouth, encouraging them to stick out their tongue constantly. The dog tries to moisten his mouth, but if he does not have access to water, the problem can get worse. Symptoms of dehydration: dry and pale gums, sunken eyes, loss of skin elasticity. When you pull the skin on the back lightly, it does not quickly return to its place. What to do? Offer your dog fresh water and monitor his intake. If he does not accept the water or continues to show signs of dehydration, take him to the vet immediately, as he may need IV. Pain and discomfort. When your dog is in pain, whether from internal injuries, joint pain, or chronic illnesses, he may stick his tongue out more than usual. This happens because of the release of stress hormones, which speed up breathing. The increased respiratory rate causes the dog to stick his tongue out more often. What to do? If your dog is listless, limping, or showing signs of pain, crying, licking a specific part of his body, or hiding, see your vet. Avoid medicating him yourself, as human medications can be toxic to dogs. Respiratory problems. Respiratory diseases, such as bronchitis, pneumonia, or a collapsed trachea, can cause difficulty breathing. In this case, the dog sticks out his tongue while breathing with his mouth open to try to get more oxygen. Warning signs: panting even at rest, blue or purple tongue, cyanosis, frequent coughing. What to do? If you notice these signs, seek veterinary care immediately. A blue tongue is a critical sign of a lack of oxygen in the blood, which requires immediate care. Hypoglycemia, low blood sugar. In small dogs, puppies, or those with metabolic diseases, hypoglycemia can cause weakness and tremors, and the dog may start to stick out its tongue involuntarily. This is due to loss of muscle control. What to do? Offer a glucose solution, sugar water, and take the dog to the vet. Hypoglycemia can be fatal if not treated quickly. Poisoning and intoxication. If the dog comes into contact with toxic substances, cleaning products, poisonous plants, dangerous foods such as chocolate or grapes, it may start to salivate excessively and stick out its tongue repeatedly. This is the body's attempt to eliminate the toxic substance. What to do? Do not induce vomiting without veterinary advice. Take your pet to the vet immediately and inform them of what he or she has ingested. Early treatment can save your dog's life. Neurological diseases. Some neurological diseases, such as seizures, epilepsy, or neuromuscular disorders, can cause your dog to stick out his or her tongue involuntarily. During a seizure, the muscles in the body, including the tongue, become uncontrolled, and your dog may stick out his or her tongue or stick it out in an uncoordinated manner. Warning signs of neurological problems: body tremors or seizures, loss of balance or difficulty walking, involuntary movements of the mouth and tongue. What to do? Keep the dog in a safe place, away from objects that could hurt him. Do not try to hold the dog's tongue, as this can cause injuries. After the seizure, take the animal to the vet for neurological examinations. If the seizures are recurrent, ongoing treatment may be necessary. Mouth and tongue problems. Wounds, inflammations, abscesses, and oral infections can also cause the dog to stick out his tongue constantly. When there is pain or irritation in the mouth, the dog may try to relieve the discomfort by licking his lips or leaving his tongue exposed. In addition, Objects stuck between the teeth or cuts on the tongue can also cause this behavior. Warning signs: strong bad breath, halitosis, presence of blood in saliva, difficulty chewing food, swollen or very red tongue. What to do? Carefully inspect your dog's mouth, if he allows it, to check for any stuck objects, wounds, or swelling. Never pull out sharp objects yourself, as this can aggravate the injury. The best thing to do is take your dog to the vet, who will safely remove them and treat any infections. How to know if sticking out your tongue is normal or a cause for concern? Many dogs naturally stick out their tongues, especially brachycephalic breeds, such as pugs, French bulldogs, and Shih Tzus, due to their flat snouts. However, if the behavior suddenly appears, accompanied by other symptoms, lethargy, excessive salivation, apathy, panting, it is a warning sign. Breeds most likely to stick out their tongues. Some dog breeds are more likely to stick out their tongues, even when they are healthy. This is due to anatomical and physiological factors. Here are some of them: brachycephalic breeds, pugs, French bulldogs, English bulldogs, and Shih Tzus. Due to the flat shape of their skulls, these breeds have a proportionally larger tongue in relation to their mouths, which causes the tongue to often stick out. Chow Chow and Shar Pei. These breeds naturally have a blue tongue. If your Chow Chow's tongue is darker or purple than normal, it could be a sign of hypoxia, lack of oxygen. Small breeds. Dogs such as Chihuahuas and Pinschers may also stick out their tongues if they are dehydrated or have hypoglycemia. This is especially true in puppies or very old dogs. Tips for avoiding tongue-related health problems. To ensure that your dog is in good health and does not need to stick out his tongue abnormally, follow these preventative tips. Keep your dog well hydrated. Make sure your dog has constant access to fresh water, especially on hot days. Dogs that live in hot, humid places are at greater risk of dehydration. Avoid overheating. Do not take your dog for walks during very hot hours. Prefer walks in the early morning or late afternoon. Avoid intense exercise on hot days, especially for brachycephalic breeds. Be careful with food. Avoid offering prohibited foods, chocolate, grapes, onions, and always check that your dog has not ingested foreign objects. Keep your dog's oral health up to date. Brush your dog's teeth regularly and take him to the vet for dental checkups. Healthy teeth prevent oral infections that can cause your dog to constantly stick his tongue out. Watch his behavior. If your dog starts sticking his tongue out in a different way, keep an eye out for other signs: vomiting, apathy, excessive salivation. Early intervention can prevent health complications. Don't ignore neurological signs. If your dog has seizures, loss of balance, or tremors associated with involuntary tongue movements, take him to the vet as soon as possible. Neurological diseases require specialized treatment. When to see a veterinarian. If your dog is showing his tongue abnormally and shows any of the following signs, seek veterinary help: excessive salivation or very dry mouth, continuous panting and shortness of breath, blue or purple tongue, weakness, fainting or lethargy, signs of pain, persistent vomiting or seizures. Your dog's tongue is a health thermometer and can reveal a lot about the animal's general condition. Pay attention to the signs, and if you notice anything different, do not hesitate to seek professional help. Conclusion: showing the tongue is not always a cause for concern, but it can be an important warning that something is wrong. If the behavior is accompanied by symptoms such as fever, difficulty breathing, dehydration, seizures, or apathy, seek veterinary help. Early diagnosis can save your four-legged friend's life. Always pay attention to your dog's behavior and remember, he can't speak, but his body and actions say a lot. In addition to being a health thermometer, his tongue can show what he's feeling. If you have any doubts, don't hesitate to seek professional advice.